Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Athaya Haura, and I am one of the researchers for the studies of prevalence and characteristic of MASKNE in clerkship student, Faculty of Medicine, Jenderal Ahmad Yani University, CIMAHI year 2021. And this is the researcher team. There are 4 people. For the background, it is COVID-19 is a disease that is contagious and spread very quickly. This virus is transmitted through respiratory droplets, and one of the ways to prevent transmission is to use a mask. However, long term of using masks can cause side effects to the skin. One of it is acne vulgaris. One of the triggers of acne vulgaris is increased excessive sebum production. Acne vulgaris that appears due to the use of mask has a new term called MASKNE, which is a combination of two words, mask and acne. There are several factors that can affect the emergence of MASKNE, which is the length of use of mask and the type of mask that used. For method, it is a descriptive research with cross-sectional, and the data itself is primary data in the form of questionnaire, and the purpose is to determine the prevalence and characteristic of MASKNE in clerk student, Faculty of Medicine, Jenderal Ahmad Yani, University CIMAHI. For research subject, the population is clerkship student of Faculty Medicine, Jenderal Ahmad Yani, University CIMAHI. The reason I choose clerkship student is because they have a lot of contact with patients, so they are required to use protective equipment such as mask. For inclusion criteria is who carrying out the clerkship at the hospital, willing to sign the research informed consent, and willing to be photographed. For the exclusion criteria is suffer from skin disease on the face other than acne vulgaris, and currently taking drugs with acnogenic side effects. For number of sample, I'm using Slovene formula, and this research have 328 population and obtained 77 respondents. This is the research flow. For data analysis, the data obtained by the respondent will be analyzed descriptively with a statistical software program, and the results of the study are presented in the form of narrative accompanied by frequency distribution table. For research ethics, submit a research ethic at Faculty of Medicine, Jenderal Ahmad Yani University, and respondent will be given an informed consent. For research place, it is at Dustira Hospital Cimahi. For result and discussion, the first is in this result is from 77 respondents, there are 59 people who experience MASKNE. And the next is result for prevalence of MASKNE based on respondent characteristic. And the first characteristic is based on the gender. The result is there are 37 female respondents who experience MASKNE. And this result also accordance with these previous studies. The second characteristic is based on age. In this research, it was only carried out on one age group, which is 22 until 24 years old, because it was only for clerkship students. And this result also accordance with these previous studies. And then there's type of mask. In this study, the use of cloth masks was not found because they are not recommended for medical use. And the recommendation from WHO for health workers is to use the filtering fast-based respiratory mask group, such as N95 and KN95 and etc. For this result, most respondents use N95 mask, which is the total is 40 respondents. And then there is duration of use the mask. This result, most respondents have a duration of using mask for 4 until 8 hours, which is 31 people. This is possible because the longer the use is used, the longer the skin will experience an increase of temperature and humidity. So the longer the duration of wearing the mask, the more the MASKNE will develop. But the respondent of this study were clerkship students, which they had a duration of stay in the hospital only about 4 until 8 hours per day. The next is frequency of changing mask. Respondents who experience the most maskne only change their mask once a day. The total is 38 respondents. This is possible because the less frequent replacements of masks will cause bacteria that have been formed to continue to grow and cause maskne. And then there's previous history of acne. This result is 36 respondents had a history of experienced acne. The last one is based on skin type. This result, 35 respondents have combination skin type. This is because oily and combination skin have a higher sebum production, so they have more at risk of developing acne vulgaris. Conclusion and suggestion. For the conclusion, the first, 76.62% of respondents experienced maskne, 62.71% of it were female, 61.02% of it had previous history of acne vulgaris before, 52.54% of it used mask 4 until 8 hours a day, 67.8% of it used N95 mask, and 64.41% of it changed mask once a day. And the last one, 55.8% of it have combination skin type. For suggestion, the first, it is necessary to collect data and face photos directly by a researcher to avoid invalid facial photos. It is necessary to conduct research using subjects from different age groups so that the research result can be generalized to all age with more respondents. Third, it is necessary to do research on the ingredients in each type of mask that can affect the appearance of maskne. And the last one, it is necessary to do research on other skin disease caused by wearing a mask. And that's all from me. Thank you for the attention. Wassalamualaikum warahmatullahi wabarakatuh.